I'm here to share the perspective of the European Heart Rhythm Association, which is the leading organization for electrophysiology in Europe as part of the family of ESC associations, with our colleagues here in North America at the ACC meeting in Chicago. In Europe, in electrophysiology, there are three major issues currently. One is, of course, atrial fibrillation. The second hot topic is ventricular tachycardia. And the third one is heart failure and sudden cardiac death. Atrial fibrillation continues to be one of the key endemics in our field. The population affected by atrial fibrillation is growing and growing in Europe and in North America as well. Years back, we were assuming that approximately 0.5 to 1% of the population may be affected by atrial fibrillation. Today we know that it's 2, maybe 2.5%. So many millions in Europe and North America are affected by atrial fibrillation. Atrial fibrillation was for a long time believed to be an ECG diagnosis. You may have it, you may not have it. The lucky ones don't have it, the less lucky ones have it. But it was believed that you can get 100 years old with atrial fibrillation, that it's nothing which is really worrisome. Completely wrong. Today we know that atrial fibrillation is a disease with an independent impact not only on quality of life but also on quantity of life. It is one of the key drivers for stroke, with a couple 10,000s of strokes happening in our communities on both sides of the oceans. And it has a clear-cut relation to heart failure. Atrial fibrillation and heart failure feed themselves in the classical vicious circle principle. AF leads to heart failure leads to AF. I don't think so. I don't think that it's fundamentally different, because there is now for many decades intense exchange, especially between the American College of Cardiology, American Heart Association, European Society of Cardiology, and on a specialized level between the Heart Rhythm Society here in North America and the European Heart Rhythm Association. There are conferences where we discuss the best approaches to identify patients with atrial fibrillation. There are conferences and consensus documents that we develop together with the best experts from both sides of the ocean to pave the way for improved and optimized treatment of atrial fibrillation. One project which is currently going on is the consensus document on catheter ablation of atrial fibrillation, which is under constructions right now with the key experts from Europe and from North America. This is one of the key problems that we are facing in Europe and that we are currently working on. The European Society of Cardiology covers 56 national societies from North Scandinavia to the Mediterranean, the Northern African states, from Portugal until to the Russian border. So it's a huge geography, and there are huge differences in the healthcare systems within these geographies. The European Society of Cardiology is fighting to provide best treatment possible for all people in European geographies. But it is a problem, and it's just reality that the quality of care, mainly for economical reasons, is different among these countries. Everything starts with understanding, analyzing and measuring. I can share with you that the European Heart Rhythm Association has introduced the ERA White Book. The White Book is the first description of the quantity and quality of care in the different national geographies throughout Europe. So data are collected from each and every country that is a member of the European Society of Cardiology to document the options and the quality of care in the different fields of electrophysiology around arrhythmias. We take it from there. When we have seen and detected significant fields of, I would say, lack of therapeutic options, we approach healthcare politicians. We work together with the European Society of Cardiology to overcome that as good as it gets. Needless to say, it's a continuous process, but we have at least started to go into this. There is more awareness on the risks related to atrial fibrillation. There is, due to a deeper penetration of the atrial fibrillation treatment guidelines into the different fields of medicine, more intense screening for atrial fibrillation, more, I would say, structured treatment of patients at risk for atrial fibrillation or with diagnosed atrial fibrillation. Key issues are stroke prevention and prevention of heart failure. In the field of stroke prevention, we have seen significant progress for the benefit of the patients affected with the introduction of novel oral anticoagulation therapy, which proved to be as effective as classical anticoagulation with warfarin, but goes along with significant fewer risks.